Heart health is a major concern in the U.S., but some experts are questioning just who should be tested for heart disease and how. Local 10 medical specialist Christy Kruger has more in today's HealthCast.
Well, from electrocardiograms to stress tests, there are lots of tests out there to diagnose heart problems early on. But that doesn't mean that everybody should undergo these expensive procedures. That's why cardiologist Dr. David Walensky says people of low risk for heart disease don't really need any special tests, and people at a high risk need a lot of them. But for patients right there in the middle, and that's a lot of us, Dr. Walensky says a simple test called a calcium score can lead to preventive action before a problem develops.
The calcium doesn't hurt you. The calcium reflects the fact that you have disease built up within your artery wall. And it's the active plaque that causes the problem. So if we can give medicines to slow down the inflammation, slow down the clot formation, stabilize the plaques in those arteries, which we have identified by picking up the calcium score, yes, we can do quite a bit to reduce risk.
Also in today's HealthCast, new global guidelines on the treatment of heart failure strongly endorse the use of a drug that was released last year with a lot of fanfare. We talked about it a lot, but many doctors aren't really so sure it works. Cardiologist Dr. Adam Splavor says the drug Entresto was intended to replace two older types of medications for patients diagnosed with heart failure. He says the problem is the drug is expensive and doesn't eliminate the need for other medications that patients have to take.
It's not going to clear the deck. It's not going to allow them to skip this, that, or the other thing. It's basically going to just be a substitute or maybe in addition to what they were already taking.
Dr. Splavor says the real-world benefit of this drug may not be fully clear until it's been out in the marketplace for a couple more years. And that's today's HealthCast.